Hello, everyone. This is Dr. Perry from Stop Chasing Pain, and my topic is going to be breathing for a better brain, techniques to influence blood flow for optimal performance. So this is when people ask me, well, what in the world does breathing in a better brain have to do with coaching business success? Well, it's hard to coach people and it's hard to run a business if your brain is a hot mess, if your brain is on fire, if it has poor blood flow going in, poor blood flow going out, inability to remove waste products from the brain as well. And if you have poor breathing, that leads to all of those things. So it's really difficult to take yourself to the next level of success when you may be tired, fatigued, lethargic, you can't sleep, or if you do sleep, one, it might not be restful. You wake up a lot during the night, or maybe you sleep all the time, but you still don't feel any better. Those are usually indications that your brain is on fire. So if we can start to clean up your brain, help you get better breathing, we'll show you some different techniques. What I will contend is it can make everything that you're trying to do in your life that much better. Otherwise, you're really going to struggle. Okay. So we're going to show you some simple techniques, manual techniques you can do for yourself. You can even teach these to your clients if you're working with them in a capacity. And I'll show you some of my favorite breathing exercises, okay, that you can implement right away. This is about giving you some simple yet really effective things that you can do on a daily basis. And I always say this phrase, effective things don't have to be complicated, okay? And I want people to actually do them. So let's talk a little bit first about stress, okay? Life is stressful. Being on this planet is stressful, but stress is not a bad thing. You need stress. It's just that fine line of, can I recover from stress? Is it incessant stress? Is it never ending stress? Because being able to adapt to stress is what makes you a hashtag beast mode monster. So you can go harder, faster, stronger, longer, right? But the body has a certain capacity for stressors and an adaptation limit for stressors. So I always use this a kind of a bucket analogy. Now, allostatic load is the fancy kind of medical term for how much stress you can tolerate before you break. So think about that bucket. What I want you to see are all those different arrows flowing into that bucket. Another easy way to say that, that's called LIFE, your life. Look at the external side. I mean, everything coming in from it, from work, relationships, social media, news, all that sort of stuff. You can't escape it. The more you're going to be on social media, the more toxic you're going to get overall in your body and your brain. Okay. It'll melt your brain if you're not careful. And then you have internal stressors. Okay. That's the big one, is how you think. And here's a little brain twister. How you think is going to be dependent on how much blood flow you get to your brain and how much waste you got stuck in your brain and how well your neurons can wire and fire and connect. And whether your brain can change itself, called neuroplasticity. In order for it to change itself, it needs a heaps of blood flow. Okay. You got poor diet. You have poor sleep. Who has a poor diet? Most humans on this earth. Okay. A lack of exercise or too much exercise. That's a big one. And poor gut health, which will link back into excess stress or poor diet. But I want you to look at those ones surrounded in green right here. Okay. That's fluids. If you have poor movement and flow in your blood fluid, arteries and veins, and your lymphatics. Your lymphatics are part of your immune system and your vascular system, and their job is to kill things that are trying to kill you and remove waste products that I call muck from the body. And breathing, poor breathing. So all that stuff's going into your bucket, right? And then it can break your bucket. But what we're going to try to do is, how about we take some stuff out of the bucket? How about we pour some stuff out? The two things I'm going to tell you is, if we work these points I'm going to show you for your head and your neck, we teach you to have a stronger neck. That's always a good thing because it holds up your brain. And alter your breathing pattern. That's two big things in your bucket that you can tolerate, right? And breathing is the number one way you can control your autonomic nervous system. So what's your autonomic nervous system? That's your sympathetic nervous system, the fight or flight. That's the one that, I got to get away. I got to survive. And so that's the fight or flight. And then you have the parasympathetic. That's the what they call wine, dine, feed, breed. I can eat, I can drink, I can chat, I can have sex, all that sort of stuff. So here's the thing. You can't be in both of those modes at the same time. It's light on or light off. It's like a light switch. That's it. So sympathetic dominance, right? That's like fight or flight. That's can be a breakdown mode. And then the parasympathetic, that's the healing and recovery mode. Can't do both at the same time. Healing, the fight or flight takes priority because here's what I tell people. It's hard to heal when you're dead. So let's not be dead. So let's talk about the brain a little bit. What does it need to function? Okay. What do brains need? Well, they need a ton of stuff, but let's go over some basics. One, they need oxygen, because if brains don't get oxygen, you don't get better, and you get brain fog, and you can't think. You need glucose. So that's why the nutrition's a big component. You just don't want to get overloaded with that stuff. So watch your sugar intake and your crap food intake. It needs stimulation. That means using it. Okay. Cholesterol is a big one as well. It needs fats. Essential fatty acids are one of the most important things you can do for your brain, for brain health. And most people are lacking in essential fatty acids. And it needs water. I mean, if you look at the stats, I think it's like 60 to 70% water. And most of your body is water. Now imagine if you're dehydrated. Well, then your brain's going to really struggle. What happens if you got all those? You got poor blood flow, you got poor oxygen, you have a crappy diet, right? You got cholesterol that's off the charts, you got fats, not the kinds you want, and you're not drinking water. And then your brain needs to clean itself. Now, I put this picture up here over this one because what they find out is that the brain cleans itself at night when you sleep, if you sleep. The brain actually shrinks a lot, by 1/3 when you sleep, because now the cerebrospinal fluid, the fluid that goes around the brain, can power wash it. It can flush it out when you sleep. That's what you see over here. It's called CSF, cerebrospinal fluid influx, coming in. And you see all those red things. You don't want those red things being inside of you, because that's going to break your brain down and give you neuroinflammation, and you're going to have a big issue. And look what goes down, norepinephrine. That's that fight or flight kind of adrenaline hormone. That goes down, and then you get rid of the metabolic waste. And I'll give you one guess where it goes, to the lymphatic system. It goes out through the lymph, and it goes out through the veins. But when you're awake, that brain is not shrunk, it's expanded, and then norepinephrine, fight or flight hormone, is up. And then those waste products stay inside. So imagine if you're not sleeping, then you get a toxic brain, right? Then you get a toxic brain. Now, what I like to ask people is, how does all this stuff, like oxygen and glucose and fats and cholesterol and water, how does all that stuff get into the brain or get into a cell? Right now, you should be saying blood flow because that's how it gets there, right? Now, if I look at this picture here, don't let it overwhelm you. It's pretty straightforward. You're going to have, look at this picture up top, right? So these are cerebral, that means brain arteries, and you got quite a few of them in there. But there's two ways into the brain, right? So the arteries into the brain come from down low here off of your aorta, right here, because this is your heart pumping down here. And two routes to the brain, only two. One, you've got, I'm going to take this up. One, you've got your common carotids. So here is a carotid artery here and a carotid artery here. This is the one where if you watch movies, they're putting your hand here and you go, can I feel a pulse or not? Is this person alive or dead? So they put it right on the carotids. One up the right, one up the left. So common carotid comes up, and then the common carotid about this level splits. It goes into what's called an external carotid. That means it gives supply stuff outside the head, external. And then you have an internal. Guess where that goes? Inside here, internal carotid. And that's going to be the biggest supply to this part, the front part of your head, right in here, right? And the other route is called the vertebral artery or vertebral artery. And that's also going to come off down here. And then that goes up the side of the neck, right here, along the vertebra, right? Up the left side, up the right side. And that enters in through the back of the skull, where your spinal cord is, called your foramen magnum. It goes up, and that's going to supply the back of your head. Brainstem in the back, the cerebellum that controls the movements here. And then that's going to come up, and then these are going to connect in the middle to what's called your basilar artery and what's called the circle of Willis. You don't really need to know that stuff. I'll show you here. That's the stuff that you see in this picture here, right? Carotid artery, basal artery, circle of Willis, and then it goes out to all the smaller ones. But there's only two ways in. The arteries bring power to everything. What's the power? Oxygen, glucose, hydration, nutrition, neurotransmitters, all those sorts of things, okay? So stuff goes in, and then if stuff goes in, guess what? Stuff's got to get out. How does it get out? Well, it gets out two ways. One, through the blue stuff. So they have blue stuff, those are veins. So you have an internal jugular vein and an external jugular vein, just like you have the ones going up. And they're also along the neck. The most of it comes out through the internal jugular vein. That's why it's so big. So that takes a lot of the muck out of here out. And then look down here on the bottom. If you see these things here, these small little dots going around the blue stuff. Well, those are your lymph nodes, your lymphatic system. And then they take a lot of the muck and the waste and sends it down here. Okay, so that's the supply chain. And look at this picture here. I want you to look up top and you see this square. There's a couple of things that are coming out of your head that sit right there that are super duper uber important. Like one, I want you to see that that's the internal carotid artery sitting right here. And then you have that jugular vein right here. Remember that internal jugular vein? And then you see these little kind of a wrapping around that. That's called your carotid sheath. So it's holding it in like a layers of a sausage, holding it in. And then you can look, you got nerves that run around here. Right? So they always travel together. But that's a really, really, really important spot that you need to be aware of. And I'm going to show you. It sits right here. So if you find the angle of your jaw and you run your fingers behind it right at your ear and you put your finger right here, that's pretty much where that stuff's going to drop. Now, let's talk about neck position and posture and breathing and the mouth and why it's so important. Now, if I showed you that stuff needs to come up, stuff needs to come down, and it sits right here, well, you got all the muscles that sit right here and fascia and connective tissue. It's important to know this, that muscles move bones and brains move muscles. Okay. So the only thing that's holding this head up and through here without flopping it around are going to be your muscles and some of the ligaments that you have in there. What are most people's posture like? They're rounded forward in the shoulder. They're slumping in a chair. Their heads are far forward, and they're usually looking down at a phone here. They're often, the mouth is open, and they're breathing through the mouth as opposed to the nose. But I want you to look at this position. What am I completely locking down here? Flow. Flow. And that's not going to work out well. We want to open that up. And then we need to focus on the breathing, because we're going to release these flow points and get your neck stronger so we can support your brain and your bobblehead up here on your shoulders, so that when you do your breathing, you can get optimal delivery through the blood flow. Does that make sense? Okay. Now, it's really important that you understand this, what I'm telling you here. At the collarbone here, above the collarbone on both sides, that's called supraclavicular. Supra means above, clavicular for clavicle. And this right here is the space where a lot of stuff gets stuck, backed up, and congested. And people get really tight underneath the collarbone here. That's called infraclavicular, below the clavicle, right in this region, these two spots here. Now, this is what we have to open this area up first. Why? Because this is where stuff is going to be originating from to go up. But this is also the place where stuff that's here that has to come back down has to get into. So if this area is super duper tight and restricted and rounded forward like this, and your head's coming forward, I'm trapping off all the flow points, and you're going to lose your brain quick, fast, and in a hurry. All right. So let's go back to the share screen. Now we're going to get into what do we do about it. Now that hopefully you've got sent home that, okay, this is kind of a big deal that I should focus on here. We're going to show you some reset points. Right. Now, I want you to look at these arrows going to these things that look like teardrop structures at the collarbone. So if I'm looking at you and I took off all your muscles and connective tissue, here is your sternum in the front, and then here are your collarbones, and that teardrop is supraclavicular, and below that is infraclavicular. But you have what's called Simpson's fascia. Remember, fascia is just connective tissue. In this case, it's like a teardrop tent that sits over this region. And that's really important because that controls the pressure difference between your rib cage, your thorax / rib cage, and your neck, cervical spine region. So it controls pressure and it gets really, really tight. Simpson's just the name that they gave it. I think it's for the guy who discovered it. So what we got to do is let's open up some flow points here. I'm going to show you how to rub a few places. You're going to rub and massage at the Simpson's fascia above and below on both sides, and then you're going to do a little bit of a skin lift. We're going to do the same thing up at the top, right where I showed you those things coming down besides the angle of the jaw, because I want to open that up. And then we're going to show you how you can influence the carotid artery. Both of those will do it, but then we're going to get the carotid artery in the middle, and we're going to do one at a time. You do one side at a time. And then how the subclavian artery, we can affect that with a vibration ball. Okay, you're going to open up the flow. So here's how it looks. You're going to do left side and you're going to do right side. I don't care which side you do first, as long as you do both sides. Here's what you're going to do. I take my hands and I put it above the collarbone, right in front of the trapezius muscle on the side of the neck. I'm going to press in there, but don't press too hard. Don't cause any pain. I want you to rub in circles. Do like 10 circles one way, 10 circles the other way. And you can get in there pretty deep, but don't cause any pain. And then I want you to do the same thing underneath. Rub up underneath the collarbone. And then now I want you to take your fingers, take 2 fingers, and I want you to put it underneath the collarbone. So you see, if I kind of bring my shoulder up and roll it forward a little bit, put your fingers right up underneath there and press, and that might hurt. That means you need it. Okay. Open that up. And then what I want you to do is now grab the skin above the collarbone. You can go above the collarbone or you can go on the collarbone. You can go a little bit above. Move your head how you need to. Grab the skin and lift it up a little bit. And I want you to hold it off of there for about 15 seconds. And if you have trouble grabbing the skin, just try to move your body to a position where you can grab some skin. Then you do the same thing on the other side. I'm going to go down to the right side, and I'm going to rub above the collarbone 10 circles one way, 10 circles the other way. I'm going to go below here. The light's a little bit bright, but you see. Then put the 2 fingers up underneath the collarbone, rub right there, grab the skin, and then lift for about 15 seconds. You can do the same thing at the top. Find behind the angle of the jaw, put your fingers right there, 10 circles one way, 10 circles the other way, grab the skin and lift. Same on the other side. 10, 10, grab the skin and lift. Just like that. And now we're going to do the carotid in the middle. Okay. Here's how it's going to go. Look, I've got the side of my neck and I got the front of my throat. See that? Side of my neck and front of my throat. Find the space in between. It's going to pretty much sit right in front of this muscle called your sternocleidomastoid muscle. Put your hand right there on that spot. Don't press in really far. Lightly press. And I want you to do is just press down towards the collarbone like this. All right. For 15 seconds. Don't push too hard in there because you're going to trap off the flow in the carotid and you'll feel like you get lightheaded. So it's a very light touch in there. Press in and press down. So I'm getting a little skin drag here. See that? And you hold it down there for 15 seconds. Then you do the same thing on the other side. Throat, side of the neck, find the space in the middle in front of the sternocleidomastoid muscle. Turn your head back to center. Put your hand there. Press down a little bit and then hold. Going down. Okay. That's going to really help the flow from here to here to here, and you're going to help the veins. Now you can take a vibration ball, just get a ball that vibrates. You can also get some of those massage guns. Like if you take a massage gun and you pull the trigger and it goes da, 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 like that, it's whatever you want. And I want you to put that underneath the collarbone. Don't go on it and don't go above it, but put this is like a vibration ball, put it underneath that collarbone about 20 to 30 seconds. Then do the same thing on the other side. If you have the massage gun, you put it like right in there, pop, 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 and then here, pop, 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 like that. All right. Open those areas up. You probably already feel a little bit more alert because you just open blood flow to your brain, and your brain is saying, well, it's about time you showed up because I've been wanting this for a long time. Now that we open it up, let's do some isometrics. So what you're going to end up doing is you're going to close your mouth. You're going to put your tongue, the tip of your tongue, the middle of the tongue, and the back of the tongue, the whole thing, suck it, stick it up, suck it up to the roof of your mouth and keep it there. Keep your mouth closed. and breathe in and out through your nose only, not your mouth when you do this. And I will tell you why in a moment. And we're going to look at the pictures on the right. You're going to do isometric holds for 5 seconds each way. And you're going to repeat that 3 times. And don't stop breathing when you do it. So if you look at the pictures here, you're going to resist what's called flexion, bringing your chin to your chest, resisting extension, bending your head backwards, resisting side flexion, bending your head, your ear towards your shoulder, and then isometric rotation, like you're trying to look over your shoulder. You can use 2 hands or you can use 1 hand, right? So remember, mouth closed, teeth together, tongue at the roof of the mouth. All you're going to do, if it's 2 hands, you're like this. If it's 1 hand, you're going to bring your head forward into your hand and your hand into your head. So you're pushing the head forward and the hand backwards, and do that, like I showed you before, for about 5 to 10 seconds, and then relax. Then in the back, extension. Now put your hand right here on the side of the head and try to bring your ear towards your shoulder. You don't have to crush yourself. It should have no pain when you do this. It's not like, it's not hashtag beast mode monster. It's not pain, it's weakness leaving the body kind of stuff. It's just holding it. Make sure you breathe and don't cause pain. You do the same thing on the other side. And then when you do rotation, I usually put my hand right inside the temple and I try to look over the shoulder, and then I'll look over the shoulder. So that's 1 full round. Flexion, extension, side bend, rotation, about 5 seconds apiece. Do that 3 times. Now, why do I want to do that? Because I want to have the neck centered, nice and centered, if you will, over the shoulders. So I'm not living like this. And the reason you put your tongue to the roof of the mouth is because that actually helps pull your head back, and it opens up your airway here so you can get a much better breath. And why do you want to breathe in and out through your nose and not your mouth? I'll tell you why. Because breathing through your nose does a couple of things. One, it filters out toxins through the hair in the nose. It increases what's called nitric oxide, and nitric oxide is a vasodilator, which means that opens up blood vessels to increase what? Blood flow. It drives diaphragm motion more. So you use a muscle, it's above the organs and below the lungs, called your diaphragm muscle. You're breathing in and out through your nose automatically engages the recruitment of that muscle more, which helps move organs and it helps pump lymphatic flow. It delivers more oxygen to the lower 1/3 of the lungs, where you have platelets, blood platelets, so you can get more oxygen into the body. It humidifies the air. It keeps the bacteria at bay, so you're not breathing through an open mouth, and you can end up getting gum disease from there because of dry mouth. Right? It warms the air. You can now keep the tongue at the roof of the mouth. It's really hard to do that when you're breathing in and out through your mouth. And it helps TMJ alignment because you're keeping your mouth shut, and then your tongue is at the roof of the mouth, which centers your head over your shoulders. I also encourage people to do mouth taping, because you don't want to breathe good during the day and then keep your mouth wide open at night, because you're never going to get better and your brain's going to be a hot mess. And it's not going to be able to drain itself well if you're a mouth breather at night. So this one, you can look up mouth taping. There's a lot of cool varieties out there, but it'll force you to breathe in and out through your nose, and you'll just put a piece of tape over your mouth, and it can absolutely be a big, big life changer, huge life changer. Okay, just doing those things right there can be huge. Now, a couple of other breathing techniques. I highly encourage you to get a book called The Oxygen Advantage by my friend, Dr. Patrick, not doctor, but my friend Patrick McGone. He's been on my podcast as well several times. So check out my podcast on iTunes and Spotify, and my website called Stop Chasing Pain. Stop Chasing Pain, and you'll find it. And get his book. He teaches some relaxation breathing, where you're going to go in through your nose and out through your nose, hopefully with about 4 seconds inhale and about 6 seconds exhale. Okay, because it's going to slow your breathing down. So basically, you'll be doing 6 breaths a minute, because it says in his book, slow breathing at 4.5 to 6.5 seconds per minute. Okay, that means about 10 seconds, has been found to optimize what? Sympathovagal, sympathetic nervous system, fight or flight. Vagal is vagus nerve. That's a cranial nerve coming off your brainstem. Cranial nerve number 10. That's the single most important nerve in the body to control inflammation and the parasympathetic recovery relaxation response. It creates an ideal balance between the two to help balance your autonomic nervous system. So what I want people to do is this: close your mouth, tongue at the roof of your mouth, breathe in through the nose for 4 seconds. Exhale through the nose, preferably for 6 seconds, and then repeat that for 1 minute, right? Now, what you can do is you can place your hands on the sides of your rib cage or hand on the sternum and the belly to make sure that you're breathing more from your abdomen. So let me show you. If you place one hand on your sternum and one hand on your belly, if you're breathing in through the nose, you want this bottom hand to move before the top hand. That's what you're looking for. Now, a better one is if you place your hands right here on the sides of the lower rib cage here. So when you breathe in through the nose, these ribs go out. So the ribs should go sideways, because if the ribs go out, I know the belly's going out too. And pay attention if one side comes out easier than the other, and try to pay more attention to the side that you get a little bit of stickiness on. Now, you can go longer than 1 minute if you want. I just want you to keep at that pace. So remember, in through the nose for about 4 seconds, no hold at the top, no hold at the inhale, then exhale. Longer exhales stimulate your parasympathetic nervous system, which is your relaxation state. Okay. Really, really critical. So simple, yet so powerful. Now, another one you can try, I always say do that one first. So this next one is power breathing. I've learned this from Gary Brecka, who learned it from Wim Hof. I work up to this one. I'll do this sequence a while before I move up into this one. But this could be really, really nice. Here's how it's going to work. Let's look through it. You're going to inhale via your nose, all the way in, mouth closed. And then I want to do a full exhale through the mouth. That's one. Then I go in, out, in, out. Okay, do that 5 times. On the final exhale, I want you to hold your breath for 30 seconds. If you can't make 30 seconds, you make what you can. It may only be 10, you may get 20, do what you can. But as soon as you feel like you can't hold it anymore, I want you to inhale fully via the nose like this. And then hold that inhale for 10 seconds. So it's an inhale. Hold for 10 seconds. And now exhale through the mouth. Okay. Then you're going to do your exhale, inhale, exhale sequence 5 more times. Remember the first one? You're going to go. Right. Then what you're going to do is go back and do your what? Inhale again and hold for 10. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. Okay. So that you do that whole sequence 5 times. Then I want you to work up. So next time, try that full sequence 6 times. Try that full sequence 7 times until you can reach a total of 15 minutes doing that back and forth of inhale via the nose, exhale 5 times, then hold your exhale for 30 seconds, breathe in through the nose, hold for 10. That's 1 rep, and then repeat out, then you do it again. All right. If you can do that every single day, it's going to make a huge difference for you. And the last one, breathing technique, is called the Ha breath. This is from Qigong, which is a form of Eastern medicine type of movement. And you're going to inhale via your nose. You're going to exhale via the mouth, and you're going to make this sound. Ha, like that. Ha. And I want you to try to make that ha exhale as long as you can. And what you're going to find is this: when you can do that with a ha, it can be a really long exhale. Like I can go almost 30 seconds on an exhale. Now, why does this work so well? One, because it prolongs your exhale. So that stimulates the parasympathetic nervous system so you can relax. 2, by the vibration you're going to feel in your throat and in your sternum, and the ha that you make by the shape of your tongue, and how you're going to have to engage the back muscles of your throat and your vocal cords. You're going to engage nerves called cranial nerves that sit on your brain stem of cranial nerve number 9, the glossopharyngeal nerve, and then cranial nerve number 10, the vagus nerve. And because you have your tongue shape in there, you're getting the hypoglossal nerve, which is cranial number 12. That's a muscle to the tongue. But basically, you're going to stimulate those nerves, which also puts you into a parasympathetic state as well. So there's a lot of neurology going into that. So let me show you. It's going to be like this. Inhale. Ha. And yeah, I could just keep going. Right? And you'll do that one. Now, what I would encourage you to do is work your way up to all of those. I wouldn't do all of these techniques that you see here in a row yet. So I wouldn't do this and then this and then this. I would do this just by itself for a few days and see how you feel. Then I would add trying this on a few days to see how you feel just on its own. Then I would add this to do every day for a few days to see how you feel. And then you can start to intermix them together. You can do this one, and then you can add that one. You can do this one, and then you can add that one. You can do this one, then you can add that. You see what we're doing? You can just go back and forth. And then when you become a monster, you can do 1, 2, 3. So what do you do now? I didn't finish the slide because I'm just going to tell you. What I would recommend is this. Do your releases of the soft tissue and your neck exercises once a day, if you can. And do those breathing techniques at least once a day or whenever you can. Make it a part of your daily habits. Make it a ritual. Try to do it every day for 30 days. That's my challenge for you. Every day for 30 days. And I want you to notice what kind of changes that you make in your life and how you feel mentally and physically, but how that also carries over to your success in many different areas, from your personal success, relationship success, financial success, work, your training and exercise, for sure. You may get to a point, people get used to feeling like crap, so they don't know what good feels like. They forget what it feels like. When you do these simple techniques for a month, you can be like astounded sometimes of, oh, so this is what it's supposed to be like to feel good and not have a brain on fire. And in that way, when you have a better functioning brain, more oxygen to your brain, well, then you're more motivated, right? To do the techniques that will make you successful. You'll be more open to coaching. and to training and enjoying life, because you're going to have more energy overall. You follow? Okay. Thank you so very much for tuning in to the talk here for Breathing for a Better Brain. I hope you learned a ton. Feel free to reach out to me, Dr. Perry on Stop Chasing Pain. I'm got a website, stopchasingpain.com. I'm all over social media as well. Enjoy the rest of the summit. Thank you, everyone, for inviting me to be a part of this wonderful, wonderful gathering. It's been a blessing and an honor, and I thank you.